So it's my great pleasure to introduce our speakers tonight. We have two speakers for the seminar, Teens and Their Parents, Promoting Stress Reduction and Improving Wellness in this Go-Go World. Dr. Agarwal, Shelley Agarwal, is teaching faculty at Lucille Packard Children's Hospital at Stanford University, as well as University of California at San Francisco, Fresno Division of Pediatrics. She is a board-certified pediatrician and adolescent medicine specialist. She has worked and practiced in a variety of clinical environments, including various international settings. She is actively involved in adolescent programs related to nutrition, disordered eating, underserved youth, and general adolescent care. Her areas of interest include wellness, mindfulness, preventative health, and applying integrative principles to assess and treat teens and young adults within a holistic model. Dr. Jennifer Durin is a clinical associate professor of psychiatry and behavioral sciences in the Division of Child and Adolescent Psychiatry. She graduated from the University of Wisconsin School of Medicine and Public Health and completed an internal medicine internship at Salem Hospital. She went on to pursue general psychiatry residency and child and adolescent psychiatry fellowship training at Harvard Medical School's Massachusetts General Hospital and McLean Hospital program. She has expertise in treating anxiety, depression, and eating disorders across the lifespan, with particular interest in treating college-age students. In addition to her clinical practice, she is active in medical education and serves on the American Academy of Child and Adolescent Psychiatry College Mental Health Committee. She is currently the attending psychiatrist on the Comprehensive Care Unit for Eating Disorders at Lucille Packard Children's Hospital, Stanford. So please join me in welcoming our speakers tonight.
Hi, everybody. Thank you so much for coming. You know, it's an evening. We really appreciate you guys coming out and participating with us. So my name is Shelley Agarwal. I'm the first person that Felice mentioned, and my section is going to be talking to you a little bit more about the science of stress. And this is just a brief outline of some of the things that we're going to go over, basically taking a look at development. Really, what does it mean to be a teenager? Taking a look at what is stress and what does stress mean for your mind and for your body, right? Before we get started with this, we're going to do a little exercise. I'm going to ask all of you guys just to get comfy in your chairs. So what that means is just sit back. Let the back of your chairs kind of support your back. Put both feet flat on the ground, if you will, and uncross legs. If you can, uncross arms. Put your arms, relax them on your knees if you can, palms facing up. Just get comfortable. We're all facing forward, so no one's looking at each other. So as you feel comfortable, I'm going to ask you guys to close your eyes. But first, I'm just going to describe to you what we're going to do. I'm just going to have you do a little bit of deep breathing. I want you to take some nice deep breaths. First, I want you to do 3 deep breaths. In through your nose, out through your nose. After you do 3, I want you to do 5 more. And then just kind of settle in. And we're just going to breathe for about a minute or so. And the goal is just to get you comfortable. Okay? So as you feel comfortable, once again, go ahead and close your eyes. 3 nice, long, deep breaths. And then with the 3, just transition to counting 5 more times. Let your shoulders relax. Let the muscles on your face relax. Try and make those breaths deeper and longer. people around yourself to get a little more comfortable. Now, when you're feeling comfortable, just start maybe wiggling your fingers a little bit. Let your toes wiggle a little bit. Pull yourself back into the room. And blink your eyes and slowly open them again. Is everybody feeling a little bit more relaxed? Don't go to sleep. So I was hoping that people wouldn't fall asleep with that. But an important thing I want you to think about, you probably had a busy day, everybody had a busy day, and probably were feeling a little bit more ramped up before you walked in the room. Hopefully this helped just kind of settle you down. You felt a little bit calmer, maybe you felt your heart rate slow down a little bit. You just felt a little bit of relaxation in your muscles, a little bit more ease. And I just want you to pay attention to that as we continue to talk in reference to how you can slow your own system down, and we'll integrate some of the science around that. Okay? So how many of the young people are here because their parents made them come? Those are some pretty willing hands that went up. All right. Well, thank you for coming, guys, and hopefully this will be interesting for you too. All right, so we're going to talk about being a teen, and I'm going to present more of the sciencey part of this. This is really a broad overview. I'm presenting some research, some information, but this is not a comprehensive review of the pros and cons of the different papers and things. It's a broad overview to support some of the big points that we want to make in reference to stress and the impact that it has on your body, and how to think about it, and maybe how to reshape some behaviors around it so you can manage it better. So I actually incorporate this particular slide in my academic presentations too, and I think it's an important thing to highlight for the young people in here, for the parents in here, in reference to being a teenager is a very dynamic thing. There's a lot of stuff going on at the same time. You're growing up, your body is changing, you're getting taller, you're getting more muscle, your brain is growing, your heart is growing. There are a lot of very dynamic things that are happening, and you're going through puberty. Right? And that has an impact. In the meantime, you're also changing in the way in reference to how you think. How do you think about friends? How do you think about socializing? How do you think about school? And if you think about it, once again, for the young people who are in here, maybe when you were like 8 or 9, you thought about something differently than when you were 10 or 11 as compared to when you were 12 or 13. I see you nodding your head. So there's things that are happening. You're growing and changing in reference to how you're thinking about stuff, and that's very much a part of development in reference to the various things that are going on with your body. So just so that I can get an idea of different age groups in here, is there anybody under 10? How about 10 to 13-ish? Anybody 10 to 13-ish? All right. How about like 14 to 17-ish? Okay. Anybody older than 17 to 21-ish? Okay. Okay. Parents, you can put yourself in that category. That's okay. The reason that I ask is because when we think about it in reference to development, right, really as adolescent medicine specialists, and this is a busy slide, I don't want you to focus too much on it, I'm going to highlight some points on it. We really split it up into different stages of development. We think about early, middle, late development. What does that mean in a variety of different areas? And so we think about biological development. Once again, somebody's growing up, they're going through puberty, their body is starting to change, and some of the questioning around this time can be, is this normal? Am I normal? Things sometimes don't grow symmetrically, and you're thinking, wait, what's going on? You know, why does this part of my hand seem bigger than this part of the other side? And that's very normal. This is a rapid time of change. It's one of the key times in your life when you grow, your teen years in general. And so those early years can be really defined by, you know, these new experiences and trying to think about, well, how do I fit into this? We think of young people really socializing more in groups at this time. You're probably going to parties where you're hanging out with a bunch of friends. As you get older, you head into those middle years. Things are still continuing to change. Maybe you've kind of gone through puberty, you finished your development at this point. I'm sure a lot of parents can relate to this in the sense you've seen it with your own child, but also in reference to your own experience when you were a younger individual. At this point, peers are really important. You identify with your peers. You start experimenting with hair, fashion, clothes, and a lot of that comes with what are my other friends doing with this stuff? What's popular? What's not popular? Once again, very normal. Sometimes disagreeing with your families is very common. Right? Even when you're younger, I see parents nodding their head. And that's a normal part of development. You're trying to figure out who you are, right? And so you're questioning the world, you're questioning mom and dad, and asking questions, and sometimes not seeing eye to eye on the same point is actually very, very much a part of becoming an adult and becoming your own person. So, some of that conflict actually is very normal. Now, when conflict teeters over into excessive or nonstop, that's when we worry. But some level of conflict actually is very normal. Learning how to talk about it and figure out how to move forward, that's one of the key things, right? That's one of the points we want to emphasize. Your late teen years, we think of more as your late high school, potentially college years. This is when your development, if biological or like body growth development ideally, is completed. You've gone through your puberty. You're now starting to think about what am I going to do with my life? What am I going to be? What career am I going to have? How am I going to support myself potentially? Maybe talking with your parents gets a little bit easier because you're better able to understand them, and maybe they're better able to understand you, right? But you're still defining who are you in terms of your values. How do I feel about certain things? What are my politics? What do I think about this and that? So these are very normal stages of development. And an important thing to keep in mind about this is we progress about this. We progress through this. And one of the things I saw some people shaking their head about is you think about things differently when you're 8 or 9 or 10 or 11 or 12 or 14 or 17. We generally go from being more black and white or concrete thinkers when we're younger, right? And then develop into more abstract thinkers as we get older. And that's very normal. The important point in that is you don't talk to a 12-year-old the same way you would do a 19-year-old. A 12-year-old may not have the same ability to abstract and think about consequences or long-term effects as potentially a 19-year-old. Now, of course, this is a dynamic model, so different people are in different stages. But that's an important thing to keep in mind in reference to development, and we'll highlight some of that when we talk once again more about the science. So this is a talking tips. I actually have a very different version of this even for clinicians and physicians and stuff. I put this in for parents. So in reference to maybe some of the more of that black and white thinking when you're younger, be more specific in reference to your communication. When you're talking about how shall we tackle this problem with a younger individual, it might have to be more concrete choices. We can do this or we can do that. I understand you need to stay up, or you feel you need to stay up because school is really hard and you've got a lot of homework and you're staying up until 1 o'clock, but I'm really worried about what that's going to do to your system, and we need to figure out a better way. So maybe we need to figure out you going to sleep at 10 or 10:30, what works better for you. Right? So in reference to how do you approach it at different stages, once again, being a more finite at a younger stage might be more appropriate in reference to a younger person being able to wrap themselves around certain decision making, as opposed to an older individual. If you're dealing with your 19-year-old adult child, more traditional models of talking and understanding and communicating and negotiating might work better. Okay? So for any of you, once again, young people out there who might disagree with this, please bring it up at the end of the conversation so we can get your point of view, because that's one of the key points of this as well, is to how do we improve the communication between mom and dad and you as their children so that everybody's dealing with stress better, right? Okay, so this is really busy. I don't want you to read all of this, and I actually if anybody wants to, can just shout out kind of what is stress for them? Does anybody want to just, doesn't have to be a definition, it can be an idea, it can be a situation, whatever you think might be. Yeah? Homework. That's very true. The homework is pretty stressful. Any other thoughts on what is stress for you? Schedules, exactly. Right? You're just overscheduled, you've got go, 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 You've got 10 different things to do and time for 2, and you've got to pack it in, right? So an interesting thing is I was actually looking and working on how we're going to talk about this today is the concept of stress before the 1920s and 30s was really more of a scientific definition in reference to action-reaction forces. It was very much a principle in like physics and things of that sort. Emotional stress, psychological stress is something that's really evolved in terms of the understanding and definition really in the 1900s. So ultimately, it's a variety of different factors or forces that potentially lead to tension and difficulty. And the question then becomes is, how do you think about it? How do you deal with it? And when is too much, right? Stress, to some degree, might be good for us. Right? Moderate amounts of stress may propel us to excel. So it can be motivating. Some people perform at their peak when they're stressed out, right? They've got a deadline, they've got a test, they've got a report, and they kind of organize and they're able to do some of their best work around that. Some people get more creative. Some people are able to problem solve better, right? So some thoughts, feelings, changes, and are pretty normal when it comes to stress and might actually be helpful to some degree. But when does it teeter over? And that's different for different people, right? When stress becomes continuous and intense, feels like it's starting to get out of control or you can't meet the demands of what's going on, at that point it can really become damaging. And once again, different for different people, but the important thing is paying attention to what is that threshold for you or for your family or for your child. So this is a little bit on the science and the adolescent brain. So the important point on this is we're finding from the neuroscience more and more, right, that the brain is growing and changing really until your mid-20s. We used to have an old school of thought in science that basically your brain grew until you were about 2, and then after that you basically lost cells. We know that's not true, right? We know now that your brain really continues to grow and mature probably until your mid-20s, and it's really a back to front process. And what does that mean? That frontal area of the brain is really the part of the brain, that prefrontal cortex, frontal cortex, that is responsible for more executive functioning. Should I do this? Should I not do that? What are the risks? What are the benefits, right? That area is really the last area to mature, and probably until your mid-20s. Once again, from the neuroscience, we're finding that the brain continues to have changes in it throughout our lifetime, right? So there's interesting studies that look at jugglers, right? People who juggle, they found that the area in their brain responsible for spatial processing is actually larger than other people. Right? What does this mean in the context of your teen? Some of the more quote-unquote primitive areas of the brain, those responsible for emotion, might actually mature a little bit earlier as opposed to the areas responsible for more executive functioning in terms of impulsivity, decision-making, maybe, this doesn't sound like a great idea, but I want to do it anyway, right? That might be a little bit part of the developmental process, not just in reference to testing your environment, testing who you are, but also because of brain development and those areas that help us reason through things not being quite as evolved. So that doesn't mean for the young people in here that if you do something, you tell your parents, well, it's because my brain isn't cooked yet, right? But it doesn't make you not responsible for what's going on, but in reference to parents, once again, understanding development and the changing body and brain, this is an important thing to keep in mind. And then also, once again, speaking to the appropriate developmental point that your teen might be in. Once again, younger, more concrete, more abstract, trying to understand that for your teen. So, once again, this is a little bit essentially too much information, but I wanted to add this in. So who here would agree that if you do different things with your body that you can kind of change your body? Let's say if you do like, curls, you're going to build your biceps. Everybody basically agree? If you do certain things in reference to squats, you might build your legs. So we know through certain actions and behaviors that we might choose, we can change physically our body. It's a pretty accepted phenomenon. So that concept in reference to the brain is something that we are now starting to accept as well. Our behaviors, our actions, our thoughts potentially have an impact on our brain and different areas of our brain. Okay? It's an important concept. If we look at stress, what does stress mean for our brain? We know from the science, and we're getting more and more information on this, and this is specifically related to young people and adolescents, that maybe those areas that help us with memory and like integrating information and memory, when we're really stressed out, those areas, the cells potentially change. That prefrontal cortex that was talking about executive functioning, when you're chronically exposed to stress, the cells in that area might actually sometimes change as well. It might be remodeling. When you're chronically exposed to anxiety, there's an area in the brain called the amygdala, and those cells might actually grow some more. What does that mean? That means you could potentially get more anxious, even when the situation doesn't necessarily have the same trigger for you. So we know about stress in the body, right? We know about high blood pressure. We know that your heart rate goes up. We know that sometimes it can show up as pain. So the point of this is that our mental activities can lead to changes in the brain and body, and stress can have a significant impact that isn't just in our head in the sense it's just feelings, if you will. There's really physical responses that are going on. And if you think about stress and that, tiger's approaching me, I gotta run, we know your stress hormones gotta get going. We know your heart rate's gotta get going. You've gotta run away from that threat. Now, if you're chronically exposed to this threat, even though it's not actually a tiger, and your body's chronically exposed to stress, those stress hormones are going, your body's experiencing changes, and that's going to take a physical toll. And we know that, once again, through high blood pressure and all the impacts that that can have. But we also are seeing it now in terms of certain areas of the brain and remodeling. So, another key area in reference to stress that I wanted to talk about, particularly for teenagers, is sleep. I see some sleepy people right now. And it's understandable. I bet you have a busy schedule where you probably do a lot of homework, right? So sleep, if you think about it, is food for the brain. Really, really important to get enough sleep. So teenagers in general, how many of you guys, you feel like you've wanted to go to sleep later as you've gotten older? Does anybody feel like they want to stay up later? Yeah, right? How many of you feel like you want to sleep in later? Right, your parents probably want to raise their hands for that too. So we know there's a natural shift in the sleep cycle for teenagers. This is very normal. It's very much a physical process. Even the circadian rhythm shifts. And we can even see it in reference to certain hormones like melatonin. So wanting to go to sleep later, wanting to wake up later is actually a very normal part of getting older. There's even changes in reference to certain, the architecture of sleep, you will. You've heard of REM sleep and non-REM sleep. Those even shift with teenagers, okay? And they actually shift as we move through our lifetime as well. So the average teen probably needs 9.25 hours of sleep a night. Right? Actually, the average adult probably needs 8 or 9 hours of sleep every night as well. But usually they're getting about 6 to 8 hours, if that. And I'm going to throw in my little bias here. I think we live in a very intense part of the country in reference to academics and in reference to school performance, and our young people will feel it the most, where I hear stories about people doing homework for 5, 6, 7 hours a night and staying up really late. And in reference to where is that time coming from? People are, as you mentioned, overscheduled, overworked. An important point on this, not just for the teenagers, but also for the parents, is you also have to take care of yourself. You also have to sleep. You also have to look at your schedules and see where are you overworking yourself, and how you can build in some of these health habits, not just for your own health and well-being, but also to model them for the young people around you. So sleep is a very dynamic process, right? We are now learning more and more that sleep is linked to a lot of different factors. We know that it helps in terms of if you're not getting enough sleep, you're not going to potentially be as productive. Who feels more irritable when they haven't slept? Who kind of feels like more likely to get into an argument or like, yeah, okay. So it's part of the science of your body. You need to sleep. You need to sleep in order to feel refreshed. We know that car crashes, particularly amongst young people, are related to a lack of sleep. So what do you do when you're tired and you haven't slept? Let me have some coffee. Let me have some tea. Let me have something else to wake myself up. So we know lack of sleep is linking in with people then making decisions about how to get themselves to wake up. And depending on the decision that they're making, this can be not only a cycle that over time wears you out, but then depending on the substance that's chosen can actually get pretty dangerous. So really, really important to look at our own habits in reference to regulating our sleep, and then how are we modeling that, and then what kind of limits are we enforcing so that so our teens are getting enough rest. And this is to highlight a point in reference to, once again, busy schedules, lots of things going on. Are you getting enough sleep? Are you staying up? Do you feel irritable? Do you think you might be getting anxious? Do you think you might be getting maybe even sad or depressed? So we know that lack of sleep potentially puts you at higher risk for anxiety or depression. We know that anxiety and depression can have sleep dysregulation or sleep issues linked into them, right? So this is basically a cycle that can loop in on itself, and really important for us to keep that in mind. Now, I highlighted the technology part. This is a really important point. Who has a cell phone? I want parents to raise their hands too. Okay, yeah. So there's very few people in here who don't. Who has other technology like an iPad or a tablet that they're on? Who has a computer that they're using regularly? Okay. How about Xbox or Wii, PlayStation, any of that stuff? Right, I'm sure. So we've got a lot that keeps us awake. And this is a really important thing. What we're finding actually with teenagers in particular is, especially with the cell phone, sometimes sleeping right by the bed, right by the head, kids aren't going into the deeper stages of sleep because they're listening for the alert. They're listening for the text. They're waiting for the update. And so this is a really important point, and parents might be doing it too. You got to put the phones, the tech away, ideally an hour or two before you want to go to sleep. Let your body wind down, wire down, because if you're constantly stimulating yourself with input like your phone, your iPad, your body's not going to be able to rest, your brain's not going to be able to rest. And parents, you got to model this, right? You got to model this by putting the tech away yourselves and looking at how often are you using it. Are you using it right till the end? And are you on it when you're telling your teen, get off the iPad, right? So really important to take some of these things into consideration. Now, sleep, these are some important questions that I'd like for you to ask yourselves. Where? Is it a comfortable environment? Or is the bed where you're doing your homework, where you're eating, where you're talking, where you're using your iPad, you're using your cell phone, all these sorts of things? Does your brain associate rest with the bed? Because if you're doing all of those things, the brain probably doesn't. You got to make the bed for sleeping. Okay? It's a really important thing so that your brain doesn't get wired up when you go to bed. What time do you sleep? What time do you wake up? Do you wake up a bunch at night? Just for an instance, if you're not sleeping well and you're drinking a bunch of coffee to keep yourself awake and drinking a bunch of water, you might wake up a couple of times in the middle of the night to go to the bathroom, right? Because that's what that's going to do. So looking at what are some of the habits we've gotten into that are setting us up in this cycle. Do you feel rested? How long does it take you to fall asleep? Are you thinking? Is the mind going? And that can be indicative of a lot of different things, right? Once again, maybe being overscheduled, but there's a lot of other things to think about, and basically what's going on that might be preventing you from getting a good night's rest, really looking at your habits around that. So I'm nearing the end of my section, but I wanted to end with the last little thing of when we are happy. When are we happy, right? This is different for different people, and this is actually pulled from some of the science. This is a growing field of positive psychology, mindfulness, happiness research. And there's some things that we're finding. And some of this is intuitive. We already know a lot of this, but we're in the sciences and we have to prove it to ourselves. So when are we happy? When we're in the present. This is a really important thing. Thinking about the past, thinking about the future, actually has been shown to make people less happy because you're kind of thinking about worries that might have already happened or worries that are upcoming, trying to focus on where you are in the present actually can make people happier. Getting what you want, of course, everybody agrees that makes us happy, but that's not the only thing. It's also about wanting what you have, right? When you're chasing, not only does that potentially impact people's happiness, but also their sense of meaning in life. And that's, once again, things that we're finding through some of the research. When we've slept, found that people who are sleeping, who are eating, who are taking care of themselves, actually experience more happiness. Once again, some of this is really intuitive, right? Manageable workloads. When things are overwhelming, when you don't feel like you can keep up with all of the stuff that's going on, that can be a setup and a trigger for a lot of different things. And we're finding this in the science as well. That feeling of helplessness, actually, we know can be one of the things that is the most difficult and potentially the most damaging for a lot of people. When you feel like you can't do it any different, or you feel like you're kind of stuck. So really important to keep that in mind in reference to what's going on. Now, the realities are, in reference to this, we're talking about happiness and such. Stresses exist. We're not going to be able to get rid of all of our stresses, but we're also finding, particularly from the mindfulness research, is how we deal with the stresses is really what is impacting how people then function with their environment. Right? So we talked about how the brain changes based on exposures and behaviors and thoughts. So if you have stresses, but you navigate them in a way that keeps you more calm and peaceful, we know that potentially that changes the brain in one way, as opposed to if you're feeling constantly on the go and you don't feel like you can keep up, that might change the brain in another way. So these are some thoughts. The last one I find particularly interesting. There's lots more to this. These are just the ones that I decided to include. When we are kind, I really think this one's really interesting. This is actually something, not only do we experience it when we are kind, but when we see other people being kind, it makes us happier. So this is a really neat thing in reference to social psychology, positive psychology, that I really liked. So, wrapping up my portion of things, resources. These are some. I've included some numbers in case you guys have additional questions. Once again, we're here. Dr. Doreen is also going to talk, and we can get you more information on this as well. All right, that's just references. Okay, so I'm going to pass it on to Dr. Doreen, who's going to speak next.
So Dr. Agarwal has gotten us prepared with all the science behind what's going on in your brain and why stress may have impacts on us. My job is to kind of take a step back and say, all right, knowing what we know about the science of the brain and how it works and how stress impacts us, what sorts of things can we do to try to mitigate that stress or to try to reduce the adverse complications that stress has on us? So I wanted to start out with a little brainstorm. So we ended by talking about, what does it mean to be happy? And I always think it's really interesting to talk about what does it mean to be successful? So throw something out there. Like when you think of a successful person, what sorts of attributes do they have?
Achieve their goals.
They achieve their goals. Excellent. Any other thoughts? Freedom, that's a great one. How about, the things that I hear from my patients and their families are things like, I have to get good grades. I need to have a job where I earn a lot of money. Do any of those things sound familiar to folks? So this is the list of things that I've come up with that I hear time and time again. I see so many people who are stressed out about getting into a prestigious college, making a lot of money, taking as many AP classes as humanly possible, earning straight A's in those AP classes. In the Silicon Valley, you have to not only develop a startup or an app while you're still in high school, but then you have to get acquired by Google. And if you haven't, then it's over, right? You're supposed to participate in multiple sports year-round at a very elite level. You're supposed to have a certain body type or project yourself in a certain way. And you're supposed to do all of this while having an amazing social life. Just looking at this stresses me out, to be honest with you. So as a child and adolescent psychiatrist, when I think about success, I measure it in different domains. And so the things that I think about are, how is someone doing in school? And for many young people, school is your job, right? Sometimes people have jobs on top of that, and I think that's important to think about as well. But I'm also looking at, how are you functioning in your extracurricular activities? How about leisure? Are you having fun? And what are you doing with your relationships? And the important relationships include not only the relationships with your friends and with your family, but also maybe starting to develop some romantic relationships. So I put a lot of focus on achieving balance when I talk with kids and talk with their families about managing stress. And I don't want people to misunderstand me, and I think Dr. Agarwal would agree. We're not saying that having ambition or wanting to be successful is a bad thing. Achievement is great. Having goals, wonderful. But sustaining high achievement for prolonged periods of time can be really difficult. And sometimes it can lead to things like burnout, fatigue, self-doubt, and sometimes can even escalate further into more clinically concerning situations like anxiety, depression, other sorts of things like that. So the implications of stress, the things that I'm always on the lookout for are, is someone starting to develop anxious thoughts? Are they having mood changes? Social isolation. If you have someone who used to be kind of out doing what the family was doing and out with their friends all the time, and all of a sudden they're starting to spend more and more time in their room and just not really wanting to do other things, that's usually a red flag to me. Irritability. And parents always say to me, well, how do I know if this is normal or not, right? I've got a teenager in the house. Isn't it normal for them to sometimes be having a moment? And that's true. We all have our moments. But when you're seeing a persistent change in someone's personality, or if they're very kind of touchy, have a quick fuse, those might be things to start to worry about. A decline in school performance. If you were always a straight A student and all of a sudden you're getting C's and finding it really hard to do the things that used to come easily, that might be cause for concern. Unexplained physical symptoms, that's a huge one. I know Dr. Agarwal's practice, you see a lot of people with unexplained physical symptoms. So headaches for which we can't really pin down a reason, stomach aches that we don't have explanations for, backaches. Those sorts of things are really frustrating and can have a huge impact on how we live our lives. If you don't feel good, it's going to be hard to function. Weight change, either unexplained weight loss or weight gain. Tension in your muscles, which can lead to problems with headaches and other sorts of stress. Risk-taking behaviors, so just not really thinking things through, making decisions that might not have the best outcomes without regard for consequence, and even experimenting with things like substance use. The unexplained physical symptoms is kind of a big thing, and so I want to spend a little bit more time on it because I do think it's something that we see so commonly. It's really, really a huge thing in my practice to see folks with headaches, stomach aches, back pains. And I think it's important to stress that there's a mind-body connection, and it really leads to this vicious cycle. It does not mean in any way that these aches and pains are not real, or that it's all in your head, or that you're crazy. That's not the point at all. The point is, though, that when you don't feel well, you are going to feel more stressed. And the more you're stressed, the more you're going to feel it in your body. And it becomes a which came first, the chicken or the egg kind of scenario. And the further that goes, the harder it is to kind of get some distance from it and pull out of it. And so I see people who all of a sudden are not able to go to school. And when they're missing a lot of school, then they fall behind in their coursework. And then they have more stress because they're behind. Or they start going to school and doing makeup work during class, and then are not able to learn what is actually being taught at that lesson, which again creates a whole another level of stress. So, again, the thing that's so frustrating and so anxiety-provoking is that there's no good explanation for why this is happening. And a lot of times people feel very frustrated with that. The good news is it's really reassuring. If you go to see your doctor and they do some tests and a physical exam and find that there's nothing serious going on, that's actually really good news. It means that there isn't anything serious happening. But I think a lot of times people feel very invalidated by that and feel like their concerns are not being addressed. Our goal in these situations is to say, you know what, this stinks. It is not fun. We believe that you're really having symptoms, and we need to take a step back and help you function at the highest level possible despite the discomfort that you're having. And really the best way to do that is to reinstitute that mind-body connection and to focus on the wellness and taking a step back and really trying to relax. If you Google keep calm and you find all of these, keep calm and carry on, keep calm and buy a pair of shoes. But I thought this one was kind of cute. So red flags. How can we identify if someone's too stressed out? So I think a big one is that their sleep is disrupted. They're sleeping too much or sleeping too little. They're losing interest in things that they used to really enjoy. So not wanting to go out with friends, or someone who used to be a big movie buff or used to love to read The Lord of the Rings all of a sudden has no interest in those things. Poor focus and concentration. So this is the person who used to do really well in school and all of a sudden is getting distracted by things that normally they wouldn't think twice about. Anxious thoughts, low mood. That irritability comes up again. The unexplained physical symptoms, changes in the appetite, and weight change, muscle tension, all those things that we talked about as being signs of too much stress, those are the things that we're on the lookout for. But I think the big question is, what are the techniques to manage the stress when you identify it? And as Dr. Agarwal mentioned, sleep, exercise, and nutrition are huge ones. None of us feel well if we're not getting adequate sleep, if we're not moving our bodies in a moderate way, and if we're not eating well. Now, note that I did not say that you have to be eating only healthy, organic, locally sourced, strictly this number of calories diets. It means that you want to be eating a diet that's well-balanced and moderate and allows for treats every once in a while. Human beings don't like to feel deprived. And so if for the most part we're getting a good mix of balanced foods, it's totally normal and fine and actually a good thing to give yourself a treat every once in a while. The same thing is true of exercise. You should not be out running a half marathon every single day after school. That's not healthy. But moving your body in some way about 60 minutes a day is probably a pretty good thing to do. And it does make you feel better. Another thing is to really focus on your organizational and study skills. And this is a huge one. So one of my favorite things to do when I'm meeting a new patient is to do the backpack biopsy. And so what we do is we open it up and we see what's inside. And I cannot tell you the number of times that we have found crinkled up tests that were supposed to have been handed in 3 months ago and no one could figure out what happened to them and all sorts of things like that. So investing in some actually pretty simple common sense items can really help. So having a binder, having an agenda notebook, taking the time after class to actually put the papers from that class into the folder and putting it in the backpack rather than just shoving it in a pocket somewhere. Or if you really feel like you don't have time to get to your next class, you can put the sheets of paper from that class into one folder, but at the end of the day, commit to sitting down and putting it into the binder, right? The other thing is, only touch a piece of mail or an email or something like that once. When something comes to you, figure out what you're going to do with it, and then be able to just throw it away and clear it off the desk. That's a really good way of managing things. Developing these healthy habits early on will help in the long term. And I see a lot of people who are super bright and who really haven't had to spend that much time studying because things just came really easy to them. As they move along in their academic career, all of a sudden they start to feel really overwhelmed by the amount of work because they never really learned those good organizational skills. So keeping things in the same place, so you don't have to think about where did I put my keys. You know they're in the table, but they're on a tray on a table by the door because that's where you always keep them. You don't have to be looking in the freezer because you got distracted while you were trying to put away your groceries after work, right? Healthy family communication, that's another huge one. And I always encourage families to develop good conflict resolution skills. And the big ones that I always think about are if you're having a disagreement or an argument of some sort, the ground rules are that people need to be respectful. So we don't scream at each other, we don't swear at each other. However, if someone is too hot and can't really have a good conversation in that moment, other people have to respect it if they say, you know what, I can't talk about this right now, I need a minute. However, that doesn't mean that you can need a minute forever, right? You have to be able to come back and talk about it at some point, so no stonewalling is allowed. But I think when everyone is calm and you develop these ground rules, it really helps when you are in a situation where tempers are high and you need to talk something out. Diaphragmatic breathing. So this kind of gets at what Dr. Agarwal was having us practice in the beginning of our talk. I think a lot of times we learn to breathe by, sucking your stomach in when you breathe in and then blowing out. And actually, that's not the best way to breathe. The best way to breathe actually is what I call baby breathing or puppy breathing. When you look at a dog while it's sleeping, you see its belly move out as it starts inhaling. And that's actually what you want to do. You want to push your belly out as you're bringing the air in, and then you can contract the stomach muscles as you're blowing air out. And it's really, really hard to run the to-do list in your brain when you're focusing on counting seconds for your breath in and seconds for your breath out. So that's why we keep coming back to your breath as something that can really calm you down. Progressive muscle relaxation, we're going to actually experience that in just a second. And again, it's something that a lot of times people say, I don't have time to do this, I'm too busy. And I always come back to them and I say, I think you're too busy not to do this. I'm not suggesting that you spend an hour or a half hour or even 15 minutes. I'm suggesting that maybe you devote 5 minutes to doing a mindfulness exercise as you're winding down at night and drifting off to sleep. Or maybe you say each morning, I'm going to wake up and I'm going to jot down 3 things that I'm thankful for that day. Those things, they may seem very small, but they actually make a big difference. So meditation, yoga, guided imagery, journaling, finding room for joy in your life. I think that's a huge thing that we don't put enough focus on. We're very busy about, getting our schoolwork done and participating in sports, but it can be really challenging to take a step back and say, okay, what am I doing that is actually of value for me and something that I really, really love doing? It's important to make time for those things in your life. Identify gratitude. And I think it can be really useful to find a healthy lifestyle coach or someone who can kind of keep you in line if you're finding that you're getting caught up in stress and not feeling like you're in a really good space. So I'm going to have you just have a look at the lovely flower, and we're going to get back into that relaxation space again. So this exercise begins with careful attention to your breathing. I want you to sit with both feet flat on the floor, as you did earlier. Uncross your arms and legs. Put your hands on your knees. And then again, no one's looking at you because we're all facing forward. So go ahead and close your eyes. I want you to think about the naturally occurring process of your breathing. Inhaling through your nose and exhaling through your mouth. As you breathe in and out, I want you to focus on only 2 words. Be as you inhale deeply, and calm as you exhale fully. Be calm. Be calm. Be calm. Now that we're more connected to our breath, we're going to start to focus on the muscles of the body, one segment at a time. We'll start at the bottom and work our way up. I want you to start by briefly scanning your body for areas of stress and tension, making note of any spots that might need extra attention. Begin by tightening the muscles around your right ankle, flexing your ankle and pointing your toes upward. You can fan your toes and move them around as you flex your ankle, and then relax. Now move to your left ankle. Point your toes up, move each toe, relax, breathe, be calm. Next, flex your right calf, tensing it up and then releasing. And tighten your left calf and then release. Move on to your right thigh, tightening it and then releasing. Tense your left thigh and then relax. Now we're going to move to your arms. I want you to make a fist with your right hand. Be calm. Feel the muscles in your right hand and arm contract and then release. Let go of all of that tension. Next, tighten your left hand into a fist and then relax. Squeeze the muscles of your right upper arm and then release. Move on to the left, tensing the upper arm and then letting go completely. As you release the tension in each muscle, the area surrounding it should feel loose and relaxed. Breathe in, breathe out, be calm. Now we're going to work on the shoulder muscles. Bring your right shoulder up toward your right ear, tightening every muscle in that area. And now release and gently allow your shoulder to fall to a very relaxed position. Try it on the left side. Shoulder meets ear. Be calm. Release your shoulder and let it fall. Now we're going to work on the tension in your neck. I want you to tilt your head toward your right shoulder, holding it and tensing the neck muscles. Release and bring your head back to center. And then repeat the motion on the left, tilting your head toward that side. Tense, hold, and release back to center. Drop your chin toward your chest, gently stretching the muscles in the back of your neck. Think about tightening those muscles one by one. And then release and allow your neck to gently return to an upright position. Now we're going to relax your face. Again, people have their eyes closed, so no need to worry about looking silly. I want you to raise your eyebrows to the ceiling and then rest. Do this 2 or 3 times. Open your jaw as widely as possible. Make your lips wide and stick your chin out and down. Move your jaw from side to side. You should now feel really relaxed. You've focused on all the major muscles in your body. You're quiet and calm. Now we're going to switch gears and are going to focus on calming your mind as well as your body. In this relaxed state, you can see yourself walking along a lovely beach covered with fine white sand. It's a warm day and a gentle breeze cools your back as you walk. You hear the waves gently crash onto the sand over and over. The water is warm and touches your feet. Your hair is gently blown by the breeze, and you can smell the salty, fresh air. You feel light and calm and relaxed. As you walk along, you notice some palm trees in the distance, with a lovely shaded area beneath the trees. The sand there is the perfect temperature, and you decide to lie down for a rest. As you nestle into the warm sand, the contour of your body fits perfectly. You feel completely held, and your back is entirely supported by the sand. You close your eyes and notice the evenness of your breathing and the slow, regular beats of your heart. With each inhale, you hear the word be, and with each exhale, calm. You sink lower into the sand. You feel the warm breeze and hear the gentle waves lap upon the shore. Your mind is at rest. Your body is at rest. Think only about the air that you breathe and the way that your belly rises as you inhale and falls as you exhale. You feel calm, light, and weightless. Your focus is on the moment, not on yesterday and not on tomorrow. Focus on the quiet tranquility that comes from lying here in this safe and peaceful place. You remain in this peaceful spot for a long time. You drift into a deeply calm state. You have no cares and no worries. But now you are slowly starting to stir. You've been calm and relaxed for quite some time. You begin to notice that renewed sense of energy that you get after a long and satisfying sleep. You continue to feel the sand beneath your feet. It conforms to the contours of your heel, the arch of your foot, and each toe. The sand feels soft and warm, and you want to walk. You want to feel the breeze blowing in your hair. You want to continue to feel reawakened, calm, light, and free. And as you begin to feel more alert, awake, and aware of your surroundings, you'll want to take this feeling with you. The good news is that you can re-experience this feeling whenever you feel stressed or overwhelmed. You have the power to feel centered within yourself and to find a healthy way to be calm. Okay. You can go ahead, wiggle your fingers, wiggle your toes, open your eyes. We didn't lose anyone, no one's asleep. So how did that feel? Any thoughts? I'm always surprised by how when I look at these scripts, I always think they look really cheesy and really corny, and then I do them, and I'm like, oh, yeah, this feels good. All right. So now that we're calm and relaxed, I want to get back to this idea of a value-driven life. And so the pie chart is kind of your day, and I want you to think about how you would divide it. Like, what are the major areas that you think about? For a lot of people I know, basically they think about work, TV, and sleep, and that is about it. I would challenge you to have your pie chart have a little bit more variety in it. And so maybe on the left, that's a typical day. But as you'll notice, sleep is only about 16%. School is 25%. There's a lot in there, but probably not as much time as you really need. On the kind of ideal day, we're including things that a lot of times we see as being kind of frosting or extra, right? Things that would be great to be able to do if you had the time. And I would suggest that we probably have more time to devote to those things while also optimizing the time we spend on things like sleep. My guess is that those 5, 6, 7 hours of homework each night are probably not helping us be the best students we can be. That perhaps if we took fewer Facebook breaks and fewer, time breaks to text with our friends, we probably could get a lot done in maybe 3 hours instead, or maybe even 2. And then we have time to add things like sports, friends, time with family, maybe something that you really love like volunteering or taking a photography class just for fun. Not because you are trying to become a, award-winning photojournalist, but because you just like to go out and take pictures. So I guess the question is, how do we move to the ideal day? And okay. So here's what I'm thinking about. What are the barriers? What's getting in my way? If I have an idea of the value-driven life that I want to lead, why am I not living it? Maybe I don't volunteer as much as I would like because there aren't any easy opportunities. Maybe I don't have people who can drive me to go and take a class. Maybe the burden is financial. So identifying those barriers is going to help us come up with realistic solutions to try to do it differently. And then who and what are my supports? Who can I rely on to help me lead this value-driven life? Do I have friends who share these goals, who can help me make time for them? Can we hold each other accountable? How can I motivate myself when I'm stuck? If I start falling back into the rut of the kind of typical day, how can I realize that it's happening and say, okay, we got to do this differently? And then I always like to kind of challenge people, including myself, to come up with one tangible goal each week that I want to work toward. It doesn't have to be like the best thing ever. Starting out actually small is probably the way to go. And when it comes to to-do lists, I like ones like this actually the most. So it's not just a list of things I have to do, and then every day you keep transferring over the things that you don't get done and feel bad about them. Instead, prioritize. What are the things I have to get done today? What are the things that it would be nice if I got them done, but not absolutely necessary? What are the things I need to get done over this week, this month, sometime this year, hopefully in the future? When we start to plan that way, we don't get so stressed out, and we're able to prioritize the things that we need to get done immediately. Getting back to goal setting, I think it's really important that goals are positive, realistic, achievable, and measurable, and they should always be rewarded when met. Even as teenagers, older adolescents, young adults, even folks who are well into adulthood, we're not so different from that little toddler who does well with the incentives for potty training, right? We do much better if we encourage ourselves to do something, we achieve that goal, and then we reinforce it with something. Now, I'm not saying that you have to go out and bribe people with, fancy vacations or expensive things. I think sometimes the best incentives are things that are small and brighten your day, or things that are involving family time, like maybe baking cookies together, or having a special movie night or family game night or something like that. So it's never good to work in absolutes. And so I hear every, New Year's Day, people saying, okay, this is it. I'm going to exercise every day. I'm never going to eat junk food again. And this is going to be a great year. Because those are the people who 2 days later are like, I messed up again. I guess I'll revisit this in 363 days. It's not helpful. But instead, if you say, okay, my goal is that instead of rushing out the door, not having gotten anything for breakfast, I'm going to eat breakfast at home. I'm going to try to do it 3 days a week. 5 days a week would be ideal, but I think it's a stretch, right? So I'm going to be realistic. And I'm going to try to walk home from school because that will take care of some of the activity. And here's the thing, if I make the goal for this week, I'm going to buy myself a fun new nail polish, or I'm going to download some music from iTunes. Those are the best ways to keep yourself on track. So I guess the final question is, in my book, how can you tell when it might be more than stress? So I'm always worried when I see change in mood that's lasting about 2 weeks or more. We're all allowed to have grumpy spells, but when we see persistent change, then that starts to be more concerning. Again, if someone's relationships all change or they start not being interested in hanging out with friends or spending a lot of time in their room, I might be worried about that. Life interfering anxiety. So it's totally normal to be anxious about a test. I'm not saying that that's life interfering, but if you can't go to school because you're constantly having panic attacks, that's more concerning. Misuse of alcohol, other substances, prescribed medications, that's concerning. A sustained decline in academic function, not working to your potential, concerning. And then changes in eating patterns or significant weight loss or gain, that's something that I would really likely worry about. But the thing that makes me most concerned if I hear anything about thoughts about not wanting to live or wanting to harm oneself. And that's something that's an emergency and needs to be looked at right away. When I'm thinking about, what could it be if it's not just stress, I'm looking at a number of different categories. So I'm looking at anxiety, I'm looking at mood, I'm looking at eating problems. That's what I specialize in, so that's what I see a lot of. Substance use disorders, and then people with autism spectrum or attention deficit hyperactivity symptoms. And the treatment approach is really going to be to do a careful diagnostic evaluation, a safety assessment, and then depending on what we think's going on, we may want to do a little bit of life coaching, having someone meet with someone individually, or maybe do some family work, or even do a group with other students or young people who are experiencing similar challenges. And in some cases, we may even think about medication, but that's usually something that we're thinking about down the road. And then I, too, put together some resources or areas to turn to for help, and we can make these available. There's an app for that, for pretty much everything. And so now there are apps for stress as well. So I put some of my favorites. There are a lot of meditation apps, deep breathing apps. One of my favorites is called calm.com, and it has pictures of waves rolling onto the beach and just peaceful music in the background, and it's really nice to just have a few minute fix to kind of take the stress away. So the take-home messages before we wrap up for questions are that stress is a part of life, like Dr. Agrawal was saying, but it can be counterproductive when it's not managed appropriately. And different people just have different thresholds for stress. If someone is handling a lot more, it doesn't mean that they're better, it just means that they're handling more. And recognizing the symptoms of stress and being able to identify when the level is out of control is actually a skill, and it's something that requires a lot of maturity, a lot of insight, and a lot of self-awareness. The best thing that we can do for teens and young people in general is to model healthy behaviors ourselves. So parents, it's really, really important to model healthy, realistic, and achievable goal setting, to show balance between work and fun, and a willingness to prioritize healthy habits, even when you've got work deadlines looming. On a kind of final note, teens sometimes may need some help identifying when they're in a little over their heads. And I think a lot of times we want people to be able to work it out and see what they can do. But sometimes kids really do need parents, teachers, coaches to step in and say, you know what, we have to back off. This is too much. And there's no shame in that. So I guess with that, we will open it up for some questions.